Hello, my fibromyalgia friends. Hello, hello. What is going on? Welcome to a very impromptu live stream session. I'm a little rusty on these live streams, so hopefully I do okay. But I just wanted to check in with you, just like we do. We have some live streams. We talk about some organizational updates, some personal updates, and then have a conversation randomly. So if this doesn't meet your needs at this point in time, before you leave, and even if you're watching the replay, please leave in the comments stuff that you need help with or how best our national nonprofit can support you in the fibromyalgia community. So if you don't move on through this live stream, that's okay, but just answer that question, how can we help? And leave it in the comments, even if you're watching the replay. We are here as a national nonprofit organization to serve you, the fibromyalgia patients in the community. And so how can we best do that? And that's a lot of the conversation. So if you don't get any further, please just leave us a comment if you're watching this replay on that. So how can we help you? Now, with this, I just want to do an organizational update as much as I can. A quick summer update, right? We're in the summertime. Giving everybody a shout out to everybody out there in our friends in Texas. I know with Beryl coming through, sending all of you good vibes out there. It's a lot of stress. It's a lot of things. Temperature changes, storm changes. I know it affects our body quite a bit. So sending everybody good vibes. It's summer. If you're dealing with humidity, I don't know how you manage humidity because I can't handle it very well at all. Even though I do prefer the heat, I am making a move into Arizona, so that'll be more of the dry heat as opposed to the humidity. But man, I don't envy any of you that are in humid temperatures and how you manage it. So if you do have tips, please share with other people on these on how you manage the humidity and staying inside and what that looks like. But I know all of these weird weather patterns can really affect us and affect how we feel. Speaking of how we feel, I hopefully don't have a coughing episode, but I wanted to definitely jump on because I owe everybody an update here. So we are in the summertime. Hello, hello. This is our fibromyalgia summer update, but I got a chance. I went up to Portland briefly. I am making some moves, which I'll talk about at the end too as a personal update. I got to see Elaine, which was fantastic. I love all the joy that she brings, and we're going to make sure to emphasize this whole creative play and the groups and the workshops that she offers. So please definitely connect with her. I was so happy to see her again. It's been a while. And then I'm a huge fan of supporting the USA Track and Field. So I had a chance to go up to Eugene to watch a day. I was like, okay, I'll handle a day. Sat up at the top, the very last row on the aisle seat, tried to stay away from as many people as possible. But I did bring back a souvenir. So I do sound terrible. I didn't know what it was, but as soon as I got home, I knew the muscle aches and fatigue that this is viral. Got a fever, got a sore throat. I'm like, wow, okay. Tested myself, tested negative for COVID. I've outrun this thing for over 4 years. I've been fortunate enough not to pick it up, nor did I want to because I worked in a lot of clinical groups with long COVID people and individuals that have long COVID. My heart goes out to you because it is just the weirdest thing. So I've been really, really sick. This is the 15th day going on it. I had to cancel a lot of stuff, so I apologize for that. But, on the 6th day, still symptomatic, but I lost my sense of smell, which was a big indicator as to what I've had. I retested, finally tested positive. So, and then throughout this whole time, I've been really testing positive as well. Today was the first day, 15th day. I actually tested negative, so nothing there, but still going to be careful because I have two immune compromised parents and they do spend time with other immune compromised people. So not interested in sharing the wealth here and spreading this around, but it's tough. It's taken a toll on my breathing. I'm struggling to breathe a lot, and then also just the energy wise. So it's really fatiguing me out, and I'm trying to get a lot of things going. We're going to be moving shortly. We have to do all of that. I have to start school. So it's been a really rough year. So getting through this, I'm going to try to just do this update for an organization for you. Say hello to everybody out there. Letting you know we're here. We're working hard still. There's going to be a lot of changes. So beginning with the changes to mention, we have applied for a change of name for our organization. So let's go with this. So we are a national nonprofit organization. And I know sometimes you see profiles on there that say nonprofit, but they're not really a nonprofit. We are registered with the IRS. So we are an official nonprofit organization. We rely on donations and take grants and stuff like that as well, serving the fibromyalgia community. So we're a national nonprofit. We nationally have programs executed across the country. We do work in advocacy and all of that too at a national level. But we're working on a name change. So when we started the Support Fibromyalgia Network, I didn't think we really knew what to expect. And so we're looking at a name change. So we're waiting on the IRS. We worked with a law firm to make the changes. So we got the state of California has approved the name change. And so we were waiting for the IRS, which obviously is a big, huge waiting game. So we're waiting for them to change our name. And then we are going to ramp up with some of the other changes that we have. But we have a lot of things in store for fall programs. We're going to be switching the URL. So I'm working on a new website. So we're building the website to just have more of health resources, fibromyalgia resources that you can easily navigate to, really directed towards patients. So that's going to be huge for us with the shift. So there is a name change coming. We still are a very active nonprofit organization. We believe in execution. We believe in getting things done and being very active. And this is going to let us and allow us to be more innovative and collaborate with people on a different scale with innovation moving forward, which I'm really excited about as we do this. So please know that there's a lot of changes headed our way in the fall, but it's exciting. It'll be good. There's going to be new branding involved, which I'm really excited about to encompass, again, this innovation, more mentorship, enlightenment of new ideas coming together. And we really want to support the stakeholders more, because I noticed there is investment, which is good. There are companies investing in fibromyalgia, and we need to support them more. They're not always going to be pharmaceutical companies, but there's a lot of companies out there that are working on other things that can be found helpful for fibromyalgia patients. It might require prescription, might require getting in front of physicians. And so we want to support these stakeholders so that they can make a better investment in the fibromyalgia community, because we need more investment. We need more attention for fibromyalgia. There are millions of us managing fibromyalgia for many, many years. And it's a long road and a long path ahead, but we want to give them a community where they can find this collaboration and support, and we can all grow together. And I think that's been really missing for a lot of these stakeholders. So we want to give them that new home and a new place. Besides, the big, huge thing for these fibromyalgia for the programs in the fall is we really want to punch fibromyalgia in the face with education. Going to give you a lot of education to hold on to. And then, of course, we're going to be filling in with the strength on how to implement it. So as a board certified functional medicine health coach and as the executive director of this nonprofit organization, I really believe in also supporting people through the implementation. So you're going to get a lot of education. You're going to get a lot of information coming down the pathway. We're going to have some tools, basic, even workshops, classes. This we're going to go through in this live as well. So let us know what you're looking for. But I know that it's challenging to actually get it implemented, because you're getting a lot of information inundated, but then what do you do with it? And that's the thing where we can really support you on. And that's a huge strength. And I know a lot of other health coaches that I've worked with that have been phenomenal in this area. Did a lot of group coaching work with these actual health coaches. They're board certified as well. Some of them have nursing backgrounds too. And they get it because they've lived through it too. Many of them have had health conditions as well. So they're right there implementing it with you. They do it. They talk about the things you need to get done, and they're also implementing it as well. So that's huge. And many of you know that I'm very impatient when it comes to this, especially I just had a birthday, which means I'm at 30 years, 30 years of managing, living with a chronic illness condition, chronic pain. So my journey with chronic pain started at 14 years old. It has been a long road. So when people tell me to be patient or be something, I'm like 30 years, 30. And I just saw someone, Janet, 24 plus fibromyalgia patients. Does that mean 24 years? See, and so we've been through the ringer and we've seen a lot. We've seen a lot start, we've seen a lot go. It's tiring to watch this. So something has to drastically change. And this is where we're coming in as an organization and why there needs to be a shift too with our name. A lot of questions. And I just think, I didn't think the name mattered as much, but we're just going to embrace it moving forward and really embrace that push to move forward as much as we can, because that's huge for the change, and be much more aggressive in our approach when it comes to providing this change for fibromyalgia, especially. And I know, like, I do believe that there is going to be hope. We've already seen some progress, but I'm not satisfied with it personally at all. And we got to push the system, and we're going to talk about that too as we push ahead a little bit more when it comes to all this information, because it's important, right? And so that's the big thing as we move into the fall programs. It's education, education, education for patients. So let's give you as many resources as possible. Let me know what resources, again, you feel like you're missing. We're going to tackle it a little bit more. We're going to go into depth. Videos, is it workshops? A lot of you have asked for Zooms. And so the thing I do, I like Zooms. I want to interact with people more, like in that Zoom setting. And I want to have our guest speakers and our health coaches be able to interact more in that setting. I think the problem we've had is more like the attendance. So picking the right day and time, I know, is very tricky. And so it's been hard because the love that I have for group work is very fascinating, because I know one-to-one you'll get a benefit. That's obvious, few people, but sometimes in that group work you get a balance of different people's perspectives and different people's journeys. So for example, if you're wanting to start a gluten-free diet, right? And then I can give you as much information as I can doing it myself, and that you're like, you've heard it, you want to try it, but someone in the group can offer a different perspective, because maybe they've been gluten-free for 10 years and they're like, oh yes, I remember the days starting out. This is how I've sustained this lifestyle moving forward. And that's really valuable. Just like you're doing in the comments right now, just like you're doing with other things that are happening. It's super important for people as well. And that's what makes a difference. So I like that people are chiming in and sharing comments, it's helpful to know, because again, as a nonprofit organization, we are here to serve you and the community. And we definitely have a lot to tackle. There is a lot of things that we need to work on as we move ahead, but it's important to understand what type of content you're looking for, what else we might be missing. So if you're watching the replay for this, please leave it in the comments and let us know what kind of content you're looking for, different speakers that maybe we haven't reached out to yet, because we will be populating a lot. I know we're looking to grow our YouTube channel, so please go and subscribe to that, because that is going to be where a lot of the content will live. But is it some asynchronous coursework that you can kind of go through and maybe learn the basics of fibromyalgia? We want some more hands-on stuff through Zoom. Is that something that you'd be able to attend, and does that interest you? So let us know, because again, I get very excited about things like this, like nutrition. So I know in the fall, once I start to feel better and get my voice back, I'll definitely be talking in depth about nutrition. We're going to overload you on nutrition, but like I said, I want to help you implement these changes if you so wish, and help you figure out what works for you. This is a screenshot from one of my functional medicine classes with the Karazian Institute. I'm heavily trained in functional medicine. And that's why I'm looking forward to expanding myself in clinical setting, so that I can help people implement this more. But you can see how daunting this looks, because there's so many ways that you can start. There's so many things that you can look at depending on where you're at, depending on your goals and your lifestyle. So this is important to kind of tackle, but we're going to go piece by piece in videos. And that's why I want to create video and content around this. And then also, that's where these maybe live Zoom sessions come in. We can tackle this specifically together, so people bring specific questions, maybe certain topics. That's where we're thinking that we're headed when we come up with this content. So that's why I wanted to just ask you about where it's going, because I do think that we're hearing a lot of the same content everywhere. I keep watching presentations on fibromyalgia, and I see the same exact stuff. And it's really frustrating, because I don't know if we're learning anything new or just repeating. Maybe if you're newly diagnosed, it's helpful, But for those of us living with this for, again, 30 plus years, how much more can we possibly actually just keep repeating? And that's what's upsetting to me in this setting, is that we just keep repeating a lot of this stuff over and over again. And it's a challenge because we have to figure out at some point, there's the beginner content, someone that's newly diagnosed, here's the information, but what else can you do? And there is a lot of different things that you could try. Some of it, unfortunately, is out of pocket, but we're trying to make this more accessible for everyone to access these extra tools. It's not all pharmaceuticals, even though that's a lot of the conversation. But there are tools, and that's why supporting these stakeholders that are interested in investing in fibromyalgia, because there's additional tools that might be helpful. And what we learned with fibromyalgia, there's multiple modalities that you're going to have to implement and put together in order to help yourself feel better. And you're going to layer these modalities, even if it gives you a little bit of improvement at a time, and you can layer them on top of each other so it starts to help. But we're really going to dive into nutrition because I don't think that that's being discussed enough. And I honestly have been disappointed with some of the nutrition content that comes out from the medical providers because I don't know, they make it sound like it's really, really hard for them to implement. And if you're hearing that the medical providers are struggling to implement nutrition, then that's not very motivating for you to try to implement these changes as well. And there's a lot of science behind it depending on who you follow. So I think that's where we're going to just dive into a lot of the science-driven content of what it means to change nutrition, throw away some of these ideals because some of it's very restrictive and that may not be where you want to be at all. And I get that. So we're going to work with where you're at and provide that information as well. So looking forward to that type of content. Now, as far as the organization goes, yes, it's an update and we still have some more updates for you. With me getting sick, I definitely apologize because we had to cancel a live stream that we had with Crystal. We worked with Crystal from Veteran Voices for Fibromyalgia on a survey, fibromyalgia survey, and we want to actually present the data to you. So this is really important to our organization because it's frustrating. We see all these surveys passed out, and then I try to follow up with people years later, and I've been bugging some of them, and I don't hear back. So what does that mean? Did they not collect enough data? It just never go anywhere? Because I think it's really important for us to get this information, especially if you're providing the information to these surveys. We want to understand when it's completed, or if you can't give us let us know when it is completed and we can get this information because this is valuable information. We don't have enough research and information for this, and this will better inform our decisions as patients, as healthcare providers moving forward. So Crystal and I are rescheduling. I had to cancel. We were supposed to do it on June 28th. So we'll do a reschedule of that so we can talk about the survey that we worked on together, show you the results, what we learned. And Crystal and I talked about this too moving forward. Again, we just want to continue doing this type of research that is going to be helpful for all of you out there in the fibromyalgia community. So it's important for us to keep up with that stuff as well. Now, I wanted to just briefly go back. So that's part of the updates, and I'm looking at my notes because I have really bad brain fog after this too, and hopefully I don't lose my voice. So delivery of content, what does that look like in the fall? Are you interested in doing health coaching? Do you know what health coaching really entails? Because again, I would love to bring in some people that I know that are phenomenal health coaches to help with this so that you can implement these changes and understand lifestyle changes. And it's not all about nutrition. Sleep is going to be, creating sleep habits will be important. Having fun with movement, joy with movement, social activities, building relationships, stress and relaxation techniques. So it's all in that realm of lifestyle changes that's beneficial that maybe we might need some more tools in our toolkit for. So that's an important piece of that. So there are going to be some organizational updates. Look out for that too. And again, a URL change and different branding, which again is going to be very exciting as we move forward in the fall. So I'm very excited about that. And then some personal updates for everyone to know. And this is why I feel so behind and haven't been set up yet with creating content. But once we get settled, I know that we'll be starting to record content. We'll do interviews. I'll be producing more content too on all this information we can. But I'm moving to Mesa, Arizona, Phoenix for school. So if anyone out there is in the Phoenix area, please give a shout out, say hello, because I'll definitely be connecting with you. I'll be there for a bit. Why? Because I got accepted to school. So I'm going to start a Master's of Science in Nursing program. Many of you know from all of this chaos that's been happening this year, I've been trying to take my prereqs to get into school. So there is a school that, I got accepted to, was my first choice, kind of what I was actually looking for specifically, so that I can complete a master's in nursing. Because the big, huge thing, again, my North Star is fibromyalgia. So when I'm going into this, I'm really thinking about the fibromyalgia community and anything and everything that I can do. So graduating with a master's degree will allow me to provide more education pieces to even other healthcare professionals, which is a huge component of something that I am getting a little frustrated with, is training other medical providers. So this is why, and feel like I've hit a wall. I think we've been reaching out to other MDs and DOs to do continuing medical education. Credit, it's been a little frustrating because we haven't yet found the person or the people, the medical providers that have really, really said, you know what? I know a lot about fibromyalgia and I want to teach other medical providers, not just one off and not just a presentation. We are looking to scale. So we need to scale the information on fibromyalgia as much as possible. And we have yet to find that person. Even with a budget, we have a budget and we can fundraise for more of a budget, but we have yet to find that person that has actually said, you know what, I want to leave a legacy behind. I've worked with a lot of fibromyalgia patients. Now I really want to train the physicians to learn what I've learned. And I haven't found that person yet. If you're out there or you know someone, tap them on the shoulder, get them in touch, because we are still going to look for that. That is a piece that's very important when it comes to scaling. Now I'm talking about scaling fibromyalgia medical education and education for healthcare professions at scale, not just one-off. And unfortunately, it's good and bad because a lot of medical professionals, they do a lot of content online for us, right? So it helps the patients, it's helpful, but I know that a lot of people are frustrated because we just want to walk into a doctor's office and not be dismissed for having fibromyalgia. And then it would be even more helpful if they actually had a basic training on what fibromyalgia is that's updated, right? Talking about neuroinflammation, the stuff that Dr. Jared Younger talks about with research. We have neuroinflammation. There's a systemic inflammation most likely going on now. So even the basic concepts, and we're not even close to that yet. And I've heard from people, and I've traveled around the country, rural parts of the country, all of you, even in major cities, it's not happening. So the fact that we haven't reached that point yet where you can walk into a doctor's office and feel satisfied that they actually understand a little bit of the basics, or that you feel heard and they actually believe that fibromyalgia is real, we haven't overcome that barrier yet. So that's pretty disappointing to me. And that's why I'm aggressively going after being a healthcare professional. Yes, I'm taking the nursing route, which I think it'll be good because of the training that I can eventually provide. So with a master's degree and moving forward, I think it looks like I'll probably have to pursue a DNP, so doctorate in nurse practitioner. Although one of my friends says I should go after more of a PhD so that I can still educate and train and do more research, which I love research part, and work maybe through a medical college to start training medical health professionals. It's a good idea. Let me get through the first 2 years of this program, because there's going to be a lot of clinical. It's going to be hard on my body, but that medical education piece is huge. And so that is a big driving force of why I'm going back to school. So if you are a nurse, retired or currently working, if you live with fibromyalgia, you have experience with fibromyalgia, I would love to connect with you, because I definitely want to set up a mastermind in the fall. Join forces, MSN, BSN, RN, NPs. Let's start training in that sector, because I've been reviewing a lot of the nursing content as I'm getting educated. And I think this is an area that we can really update together. And so we can get people that are getting deferred. So in primary care, you're more likely now going to be deferred to primary care physicians. And I have a feeling you're getting deferred to the NPs or the PAs in the office to help you. So if you are a PA with experience with fibromyalgia, then definitely please reach out, because we need to start having these education programs and stuff like that. So it's really important piece of the puzzle. So that's moving forward. So we're moving ourselves from Los Angeles County to Phoenix. Shortly, I'm going to start that program in August, but we're definitely going to do our due diligence to stay up with content. So that's a big move, and it's something that's really important. But it's also important to me because of this piece here that you see is this, unfortunately, you see this content talked about, and I have a lot of concerns with this as well. So this is the regular thing. A lot of people ask questions, and then we promote it as the pharmaceutical path forward. And I'm noticing this too with my nursing content and how we talk about the psychology basis of where we're going with chronic illness conditions. So yes, these are the FDA approved medications that get thrown out there. And my fear, and another big thing of why I'm disappointed with how content gets put out there from medical professionals, is that it's just given like this without any caveat or informed information to the patients when you're trying to figure out what to do. It's just, here's the prescription, understand. But I'm seeing a lot of fallout with some of these medications. And if you've tried it, I understand. There's a lot of side effects with this. Some people have some success, but there hasn't been any accountability for a long time in measuring this. So we're leaving comments as patients on like, it doesn't work, they don't work. Some people have success, but there hasn't been enough accountability. And so unfortunately, this stuff keeps getting passed around over and over again. So every single presentation in fibromyalgia, you're going to see this slide. And I want to make sure that patients understand what actually they're getting into when they start being prescribed these prescription drugs, because they're FDA approved, but I have a lot of questions, and there's an imbalance. And there's an advocate that brought my attention, especially to duloxetine, Cymbalta, and what it's been doing to a lot of our community members, because there is an associated discontinuation syndrome on withdrawal when you try to withdraw and taper off of that medication. There's multiple lawsuits that have gone on since 2013, but unfortunately, this information is just given like, oh, this is it, so this is all that you can do. And a lot of our medical professionals, unfortunately, don't give you that information before you start that medication. And I'm disappointed and shocked in some ways, because I know that when the scientific information was given out, it's given for a short-term basis of understanding when they do these clinical trials on these medications. So what is the consequence of all of this going on? And I don't think we have any answers. And that's problematic when we keep repeating the same information and the same education over and over again. So this is where I really want to challenge the medical community to understand what is actually happening with the patient community, and my concern for a lot of these, because I know that with Cymbalta and Savella, it's in the same class of medications. And I tried to do some research on why Cymbalta seems to be the most prescribed one. And I found a lot of literature mostly related to finances. So at the point that even Savella came out, it was the last kind of FDA approved medication. But, I think people really knew that Cymbalta, because even in the press releases and the information and content back from 2009, so I'm reading information from 2009 to just let you know that a quote said Cymbalta is expected to challenge Lyrica for the top fibromyalgia medication in sales. So Savella was very, very far behind. So we're looking at prescribing this based on sales, which is not the right approach. Unfortunately, it's about profits. But I think this is where we can challenge the system as patients. But I really want to make sure that all of you out there understand what you're about to do and what you're about to take, because I'm definitely not happy seeing people go through the withdrawal and they're tapering bead by bead in order to get off of Cymbalta, but yet we keep giving it to people at pretty high dosages. I think the recommended was to start at like 60 milligrams, but I'm seeing people on much higher dosages with a cocktail mix of other medications, and understanding that these are in the same classes of SNRIs. So that's a serotonin norepinephrine reuptake inhibitor. It's the same antidepressants. And the more that I learn in these nursing classes based on pharmacology and with also the psychology classes. Some of the root of this is a little disappointing because what they're doing with these antidepressants is giving you a level of feel-good chemicals. So if we give you more of those feel-good chemicals, we'll make sure that you feel good. And it may work for some people in the short term, but we are looking at long-term consequences and really, again, getting at the root of where fibromyalgia might lie with this neuroinflammation information. And when we talk about neuroinflammation, there is a lot of research getting done. So I would love to see fibromyalgia actually go back into that category and be able to get funding at these institutions for brain health, because there is work being done on neuroinflammation brain research in neurodegenerative diseases and stuffs and migraine, headache disorders and all of that. So that's why this movement, and we've done a lot of advocacy work to try to categorize fibromyalgia appropriately in this neurological space, to move it into the neuroinflammation research. And Dr. Jared Younger did a great video recently on inflammation, systemic inflammation, producing depression symptoms as one of the causes. So we have to remind our providers on the basis of this systemic inflammation. So managing inflammation first as a first line potentially, and maybe why this isn't very successful with these medication routes. Now, again, some of this may be helpful for certain people. You know, it's a mixed bag, but we haven't done enough accountability that I've seen. If you've come across research that has really added this together and really done a retrospective of these medications together, please let me know, send that to me, because I keep digging around for information. And again, the comparative like between some of these doesn't make any sense. I know in the next couple of years, we're probably going to see a couple of pharmaceuticals in the pipeline. There is another company working on something. There is Tonics that I believe is looking at that for the sublingual cyclobenzaprine. So we might see that at the end of the year or early, like maybe 2025. So there is some of that. But again, these tools, we really want to empower you with other tools, non-pharmacological tools. There are stakeholders invested in the community that do have it available. They're working. We've been talking with them. There's other lifestyle changes. So I think it's important to get that also understood, because it is disappointing that this root is still psychological based, where we know it's neurological. We really know it's neurological, but we need to make sure our medical providers trained and understand that, because right now there's a huge gap. So all of the patients, you're eagerly digesting all this information online. We're talking to ourselves. We're talking to the patient community, but it hasn't reached the medical professionals, the healthcare professionals, as much as it needs to in scale. So that's a huge thing for us moving forward. So I definitely appreciate everybody tuning in. I think that covers maybe most of the stuff that I want to do for an update. So let me go through the comments and say hello. Hi, Janet. Hello. Thank you so much for posting. I know that you've been posting a lot of content here in comments, so I appreciate that. Yes, Dr. Jared Younger, I watch his YouTube every Monday. He's been really diligent with releasing a new video. Fantastic. We are fundraising right now for brain research because he is a neuroinflammation lab. We had Chloe actually on our conference this year give a fantastic presentation to talk about the research that they were working on. And they just continue to be a phenomenal group. Please go and subscribe to their YouTube channel. I would love to at one point get out there to donate my brain for any science he needs. But again, this is where I'm headed, and I'm going to send them an email too to update of getting the master's in nursing, because I also can work on research at that point even more so. So that is a goal. They're a huge lab that we readily support. We need a Spanish speaker also. Yes. I'm sorry, Janet. Like, I am half Spanish, but the skill set I have, it's driven for science. I was never a language person. I took Spanish all the time. My mom speaks Spanish fluently. If someone out there would love to help and work on Spanish content, I welcome you. Even being half Spanish, it doesn't flow like science. Like, I really understand science. I'm a science nerd, so that's what it's all about. Hi, Michael. I hope you're doing okay from Texas. Good to see you. Hello from South Carolina. I hope you are doing well. Okay, so Janet, if you can send me an email, that would be fantastic. If you're still there, just send me an email so we can understand what your background is. Let me know what your background is in helping, because we are looking again in getting some more medical providers and do whatever we can in that sense. That's fantastic. So writing in Spanish and English, fantastic. Let's connect. Again, we're rebuilding the website. So what I really want to do is find content creators from that sense too that enjoy writing. That would be helpful. And then also just creating other types of content, because again, we're going to punch fibromyalgia in the face when it comes to education. But again, you're going to get overloaded maybe with content, but we really want to help you implement this as well, work together. More social activities also is huge, which is one thing I forgot to mention. I love Elena Merrifield. Big shout out to her. She has a book, an author, but she also does creative play groups, something that I cannot cover. Brings so much joy and creativity to people's lives. So we want to definitely celebrate her work and refer people to that, because sometimes your brain, you don't want to learn science, and I get it. Some people want to do other things and have more craft, and we have a lot of creative people in our community. So we want to host more groups like that. Elaine is great at facilitating. We're also going to be I'm going to be reaching out Jacqueline, if you're out there watching, from a similar named group in Canada, the Fibromyalgia Support Network. We love the programs that they do. They do a lot of group programs throughout the year, continuously group programs. They have a crochet group, social support, all of that. So there's groups like that readily available for people that want to lean into that. And everybody's going to be different. Those resources are available. So if that is something that you are looking for, please do share with us, because we do appreciate it as we move along. Let's see, information about getting disability. Okay. Well, I can definitely, there's a good website on how to get on. I always share with people, disability is very challenging with fibromyalgia, and it's hit or miss depending on your state. It's all over the place. Some people get it faster than others. Some people it takes a long time. And so getting the right support, getting all the right paperwork is a huge thing. And I can give tips on what not to do, because I really failed in preparing for that when I was working on it in my 20s, because I had a really rough go. And it's that documentation with the medical providers, and they need to know how to document it. So we're going to have to direct them to it. That medical provider information is invaluable. You're going to need to have that information, and is going to have to be documented well in every single session. And unfortunately, I've had some people, like, when they share some of their documentation or like work right up from physicians, and it wasn't necessarily for disability, but I'm reading the commentary that the providers have written in non-compliance or well-dressed individuals. So all of that stuff is going to hurt your case. So if you're not reading the medical notes from your doctors each time, and you can ask for it. It's a huge deal. You are an advocate here. You need to get that information. So if you're not reading their medical notes after your session, go back through it, tell them, and they are responsible to correct them. It may be a big issue. And I think Patients Rising has a great blog on this, on like actually getting your medical records updated, because this will follow you along. And especially if you're using that medical record for your disability case, that will hurt you. And then there's a whole other road ahead too, with getting evaluated by their own medical physicians and stuff like that. And again, it varies state by state. I am not an expert in this, but I do want to bring in some experts on understanding the process. So what you need to do in order to get disability, and then once you're on disability, because I have heard recently from some other advocates that they've actually lost their disability after a long time, and I need to follow up to figure out what's going on. Science, lifestyle, modality changes, it can definitely help with. That is going to be huge. I think for the disability side, we're going to need it to bring in some speakers to talk about this, experts to give some more information, lawyers, because it can be a process and every state is different. Every individual case is different. But I definitely know from experience of doing things wrong is to really get on top of the medical records right now. So all the doctors that you're seeing, make sure that they're documenting the amount of pain you're in, the amount of daily life that you struggle with, to make sure that you are not able to work and that daily functioning is very challenging for you. Make sure they're noting all of that, because they don't. And sometimes, when you see them on their keyboard and they're looking at you, they sort of just copy and paste everything over, which is not helpful, especially if you are declining. So this is something to really pay attention to. So I think this is a lot. This is a good conversation. I appreciate people tuning in. I'm going to respond to comments. So keep making comments even after we close out. Thank you, Lisa, so much for tuning in. I appreciate everyone. I will try to do some more updates as we move around. I know I'm still recovering as well, so it probably sounds terrible, but we'll get back into it. Keep posting comments too as you're watching the replay. What will help? What kind of resources will help you? How can we help you? So there's no wrong answer in this. It's anything and everything that you need. I know that a lot of people always ask for medical providers. There is some progress in certain states. We're going to be talking to another company that's offering telehealth for fibromyalgia. We have been talking a lot with Swing Care, and they continue to expand in other states. They are more well-versed in fibromyalgia care than anything we've ever seen. So if you are living in a state where Swing Care is available, I would definitely utilize them as a resource and see if that program works for you. I've been hearing from more patients recently some very good feedback, which is exciting news. So, and there's another company that I need to set up a call with that also addresses chronic illness conditions in multiple states. So again, we're getting into moving some more progress. Not good enough though. We have a lot to do, and we will continue to do this. So thank you everyone for tuning in. I appreciate you. I am Melissa Talwar. I am the Executive Director of the Support Fibromyalgia Network, soon to be a new name. And I'm also a board certified functional medicine health coach. I'm losing my voice. So thank you, everyone. Have a low pain week, and I'll talk to you soon.